Well, good evening, everyone, and I pardon for the noise because I am at Panera. The whole state is out on internet except for a few spots, so here we are. Um, so what we know about Lyme right now is that about 90% of the dogs that are positive for Lyme never get sick. The chronic Lyme or the disease mistunance that we see is inflammatory arthritis, nephritis, which is kidney disease, thrombocytopenia, which means low platelets, which can cause bleeding disorders, and um, and encephalitis. Anyway, this is Brian. Um, he was positive for Lyme um, using the multiplex. Um, I tested him every year, his entire life. He was never sick for Lyme. So he was tested for 11 years, and that's pretty good for a retriever because retrievers are the breed that has the highest incidence of nephritis, Lyme nephritis. Okay, this is Gracie. Gracie's a Norfolk Terrier. She's an absolute, I adored her. When she was 5 years old, she was at a kennel. She presented one day with a lame hind leg and treated homeopathically for the assumption of an injury from being at the kennel. But the next day she presented being paralyzed in her hind two legs. I did a 4DX, which is a IDEX test, and it came back negative all the way around. The thing that bothered me is that she had a fever. This was progressing, and I was really concerned about a disease called ascending myelitis, which is inflammation going up her spinal cord. I did draw a multiplex on her and didn't get it back for a few days because it was a Friday. The multiplex did come back 30,000, even though the 4DX was negative. She was given a homeopathic remedy on the day that she came in with a different one on the day where she was paralyzed on the hind legs, and she was back to normal 100% in 24 hours using homeopathy. And then on the following Monday, I added Vibactra Plus to help her immune system, since Lyme is an immune-mediated disease. So I want to go over the multiplex Lyme test. Most people use a C6. I don't, obviously. And the reason I don't is several. I like the fact that the Lyme test, antibody test from Cornell, looks at 3 different proteins. Each protein is on the surface of the spirochete, and it has different meanings. One is outer surface protein, or OSPA. The next one is a C, and the next one is an F, and we'll talk about that in a minute. You can detect Lyme sooner with these tests than the screen. If somebody comes in and says, my dog I removed a tick the other day, maybe a week ago, maybe a few days ago, and I send it to the lab and it was positive for disease, we can check the dog through using a multiplex right away to know if it's the dog's has a problem or not. It can differentiate between vaccination from infection. It can also determine success of treatment much sooner than other tests. Like the C6, they say to wait 6 months. And depending on which proteins that are elevated, you can recheck and see a difference as soon as 4 to 6 weeks. sometimes 2 to 3 weeks, but usually it's 3 months. So OSPA, the outer surface protein A, is found in the midgut of a tick. When the tick starts taking a blood meal in a dog, the bacteria downregulates the A to almost a no detection. It actually changes to a different protein on the surface. Most vaccinations available today is OSPA. There is a new one that does attack OSPC. I don't see many people using it, but it's out there, which means that when your veterinarian sends in the multiplex to the lab, they should put down what the maker of the vaccine is, if you vaccinate for it. And as I'd mentioned briefly above, that sometimes a low transient antibody value can be detected 2-3 weeks out from exposure. OSPC, this is the one that I call acute, and so does Cornell, protein. And it's when the bacterium or the spirochete goes from the tick into the warm-blooded host. It changes its surface protein from an A to a C. It detects early infection. You can see it in 2 to 3 weeks. It decreases in 7 to 11 weeks and is undetectable in 4 to 5 months. But I will tell you, because there's so many ticks out there, it's easy to get reinfected, and I've seen it a little bit later. On the tests, they check for A, C, and E, A, C, and F. And if we're looking at early exposure, it's a positive C with a negative F, or you can have a positive C with a positive F. And this is the one that they recommend testing 6 weeks after treatment. Now, this is allopathic, or conventional, and they're talking about after treatment of with antibiotics. The F indicates chronic Lyme exposure. It can be detected as early as 5 to 8 weeks. It indicates if it's a positive F, negative C, that's an exposure that's probably about 5 months out. I often get someone saying, I haven't seen any ticks. How can my dog be positive? When did it get exposed? This is another reason why I like the multiplex, because I'm going to actually answer that question to the dog parent. And the OSPF protein in the multiplex is similar in detection as the C6, and that's through the IDEX lab. There's also a lot of changes in the environment of so the bacteria will change, and that's pretty much what I had mentioned. When you go from A to C, you go from really acute, going from the tick to the dog, turns to a C, and then because of the environment in the dog, it can change to an F.